Well, it's just wonderful to be here with both of you, Shivani and Renata. And I might just add little Cookie there. He's decided to perch himself there. Shivani, you had a few questions to ask.
Yes, I did. I've gone through my own wonderful journey of having children, and I'm so glad that we're getting together and talking about these things because, you know, so many of my friends have questions around IVF and fertility and, you know, why they can or cannot conceive. So, yes, I do have a couple of questions. Renata, you know, I'd love to know, obviously, you know, we've both had wonderful experiences with Dr. Jenny Cook. How did you come across her?
Well, yes, I first actually listened to a webinar, which was an information session.
Okay, I didn't know this.
Yeah. So I was living in Melbourne at the time, and so I'm from Sydney, so I was away from home, and I'd just come out of a relationship, and I was sort of thinking, I really want kids, but maybe I should learn about freezing my eggs. So I think I was 34 at the time, and I just was like, yeah, I'll find out. And so I had this webinar that I went to, and I was like, oh yeah, okay, I think maybe I'll freeze my eggs. And I then moved from Melbourne to Sydney in the middle of all this. This was just when COVID had started and Melbourne was in lockdown, and
You got out at the right time.
I got it. Well, I did
perfect.
half of the year in lockdown, and then I came home and escaped the next 6 months, which was great. And so then I came back and I called to have a nurse chat, and they're like, oh yeah, you can have an appointment next week. And I was like, oh, okay. That was quicker than I thought. And so I had that appointment, and
we met.
We met, and I felt really comfortable and was very reassured that it was just like, yeah, we can do this. And I was like, oh, okay, yeah, we can do this.
Yeah, and I would say that it's getting over that first psychological hurdle. I talk to a lot of women who make an appointment, even women who sit in the waiting room and think, no, I just can't do this now. And I think the thing for women to know is you actually can do it now. And we do all the baseline fertility investigations to start off with, and if they all come back normal, I'd say that's reassuring, that's a positive thing. It's an opportunity to freeze really good quality eggs.
Yeah, well, I mean, I was lucky, so
You were,
it all went really well. And I, like you say about that psychological hurdle, it felt like a big deal to me at the time to make that decision. But once I actually went through that process, it wasn't as big a deal as I thought. And I actually, I was dating at the time and it was putting a lot of pressure on me dating, knowing I wanted kids. And I was sort of dating thinking, can you be my baby daddy? And that it's not a good way to do it, I think. And so yeah, after I froze my eggs, thinking that would make me relax and give me more time, I kind of actually just went, oh, I really want kids. I'm going to do this.
And see, I think that's wonderful. And I see that as well. When you're actually in the middle of it, you think, why am I doing this? What is the end game? I actually want a baby. I'm just going to do it.
I want a baby, yeah. And
So did you go ahead and go straight from egg freezing to
Pretty much.
IVF? I'd love to hear your journey.
yeah, I actually did. And I'm not saying that that's for everybody, but for me, I was having a conversation with an uncle and a cousin who, both males, who I didn't expect this kind of support from. And they sort of said, well, what are you doing? Are you dating anyone? Or like, what's happening? And I said, well, you know, I just froze my eggs, and so I thought maybe in a few years I might have a baby on my own using a donor if I haven't met anyone. And they both just went, well, what's going to be different in a few years except that you'll be a bit older? Why don't you just do it now?
And I now encourage women to talk to other people, to talk to close friends and to relatives. And I think a lot of the time they have an expectation that it's going to be negative, that people are going to say, why would you do that? But it's not like that at all. People are generally very encouraging. If you want to have a baby, just do it, and we'll find a pathway to make it happen.
Yeah.
And you can't plan everything down to the last minute. What do we say? You cross those hurdles as they happen.
Yeah.
Yeah, absolutely. And I mean, I certainly found that was definitely my experience, that it was so positive from everyone I spoke to. And so I froze my eggs in December, and then I had an appointment in the May, and then I was pregnant in September. And so it wasn't even a year. It wasn't even a year for me between sort of thinking I'd put myself off for a while and then, followed that process.
What was that like for you? You're sitting there with your uncle and your cousin and you get this amazing encouragement. But at the same time, were you thinking in the back of your head, hang on a second, I'm going to go and do this on my own?
Yes.
And just go ahead and have a baby or two now.
Yeah, absolutely. Yeah, so I do have two now. And it was never my first plan. You know, when you're a little girl, you don't grow up thinking, I'm going to be this powerhouse woman that has kids on my own. That wasn't my plan. But I did I knew that I wanted kids. And so I have a family support. I've got great friends around me. I know quite a few single mums.
You've got the village going on.
I have the village. It
takes a village.
It does, yes. And, I couldn't do it without the village. Like right now, my dad has my two little boys and he's helping me out. And
the little baby's just woken up and potentially needs a little breastfeed.
Yes, I can
But we've got
imagine.
the little one held off.
Yes. But yeah, so I kind of just thought, I'm a really capable person and I have support around me, so I'm going to give this a crack. And to be honest, the second child wasn't a decision. Like the first one was the big decision, but then you're already doing life with kids, and you're juggling life and childcare and work and social life, all of the things, and then you're just looking at this beautiful little human that I made with help. Thank you.
Yeah, and that's my absolute pleasure.
Yeah.
Yes. And
But you did a lot.
and I mean, sure, it's hard sometimes. And it's parenting is hard, even when you've got a partner. But I knew as soon as I had the first one that I would be wanting a second one. I'm now trying to tell myself not to have a third one, to be honest, because I'd love another one, but I think two's probably good. Yeah.
That's such a wonderful, positive story. And how did you find the rest of the team? Like, I obviously saw you. I took you through the whole process. We made it happen. But there's a lot of people that are working there as part of the team.
Yeah, absolutely. The team were incredible, the nurse, and you get to know the nurses because you're going in every few days, and I think it's first thing in the morning when you're going in. So, that can be hard for some people to be getting there before work, and they're all beautiful, friendly faces and just so kind and supportive. And I know, like, my experience in terms of success was really positive, and I got pregnant first go. And everything went really well. And so I imagine for some people they need a little bit more support, and they absolutely would find it there. Like, the nurses were just kind and understanding. And I think given they do this every single day, I don't do this every single day.
Yeah.
This is a big deal for me. They understood that.
Yeah, and that's what I say to women as well. It's what we do. I know it seems overwhelming, and I can explain, everything that you've got to do, but when you're there, we'll be supporting you every step of the way.
Yeah. I remember
the highs and the lows.
Yeah, like when I went to freeze my eggs, and I had that first session with a nurse who explained to me how to do the injections, because I was terrified of that. And when she said, "Oh no, it's fine, you're going to do one right now," and I was like, "What? Right now?" She's like, "Yeah, it's fine. You'll be able to do it." And I did it, and it actually was okay. And I was like, "Oh, okay. Like, this is going to be fine. It's all going to be fine." And they were so caring and understanding. It was a really lovely experience. I've recommended Monash to actually friends who've just said, just go and have an appointment. Just go and have a chat. And that's how you can
break
start.
the ice.
Yeah.
And what about the actual process of choosing the donor? Was that hard?
It wasn't that hard for me, actually. I was given access to the database. I don't know if you call it that, database. So I was given access, and I had a look through, and like because we're in Australia and it was using the California Cryobank, which is overseas, we have access to certain donors. So you don't have access to all of them because in the States they don't have to be, I don't know the terminology.
They're not compliant with New South Wales.
Okay,
not
right.
all of them.
So so we have access to certain compliant donors that we can use in New South Wales.
We have to follow, just for everyone's interest, we have to follow the New South Wales Reproductive Act very closely. So any donor sperm or donor eggs that we use need to fulfil certain criteria. One of them is that the person who donates needs to understand that the child can contact them when the child turns 18, but no one else can contact anyone else. So they're traceable, they're de-identified, whereas in other countries, by law, the donor can never be contacted, which we feel in Australia is not right. It's for the child. It's for the child has the opportunity, if they want, to meet other siblings or their biological parent later on. The donor also needs to have had certain counselling to understand the implications of being a donor. They need to have had a certain standard of screening, genetic screening, infectious screening as well. We would offer a more extensive genetic screening, I know, than a lot of other places. So there are certain criteria that we want to see that have happened so that we can, and the sperm and the eggs need to be of a certain quality as well. We want to give women the best opportunity that they can and the confidence that they're in a safe situation.
Yeah. And so that was part of why I could access certain donors based on the compliance. And so I was given a list of donors that I could choose from. And I basically ruled out a lot based on ethnicity. And that was purely because I wanted to know that my child would look like me.
Yeah.
I didn't want to bring a child into the world that was going to be saying, where do I belong, or anything like that. So once I think I narrowed it down to about 8, and then I really took the time to read through the profiles and that kind of thing. Then I narrowed it down to 2 from that, just because I kind of vibed with the information, I guess.
Yeah.
I was just like, oh yeah, this sounds like a really good human, you know? Like okay. And honestly, between the 2 that I narrowed it down to, it could have been either, you know. And I've never looked back. I mean, I don't look at my child and think, oh, I should have chosen the other one or anything like that. That's just my kids. And I've heard that from a lot of other solo mums who've used a donor, that the donor actually doesn't matter that much. It's a big deal for some people, but once you have your child there, you know, that decision's...
It's in the past.
It's in the past. It's done, yeah. And so I was lucky that I created embryos from one egg retrieval, and I was able to have a number of embryos, so then I could have my second child the same. So they're full biological siblings, my boys. Yeah.
So Renata is very lucky like that. She's had one egg collection and she's got 2 beautiful little babies.
Yes, and I actually had
Ricardo and Raphael.
Yes, that's right. My two R boys. But I also had the eggs from when I froze my eggs, and I've recently gone through the process to donate those eggs so that someone else will be able to use those. So
that's an extra step further on.
An extra step, yeah. But it did feel nice to be able to sort of give that back to someone else who might be interested to and needs donor eggs. That, you know, there's a lot of people out there who want to have babies who might need that. So yeah.
Very generous. I like just a wonderful, generous offer.
If I didn't have a donor, I wouldn't have my kids.
Yeah.
So, you know, it's good to give back. Yeah.
I think, you know, I know so many women in my life who are thinking about going through this journey solo as well.
Okay,
and,
I didn't know that.
I really think about what you've said around it's a process and the only way out is through. And you start and it starts to get simpler. But I'd love to know for you, in reflection, what are some of the biggest, you know, lessons that you've learned that, you know, women watching you think could really benefit from?
Oh, yeah. That's a great question. You 100% you need the village. So you need to make sure if you're going to embark on this journey, I'd say solo, but hopefully not solo, with your village, without a partner, I'll say. You need to make sure you have support in place, and you need to be willing to accept that. Somebody said to me when I was going through this process, you just need to say yes. If somebody offers something, say yes.
Yeah.
Say yes. You know, someone says, can I drop around food? Yes, please. Thank you. That would be great. So just say yes when support is offered would be the biggest piece of advice, because you sort of think, oh, this is my responsibility. I've brought this child into the world and I'm doing this. But you really do need extra support, because 24/7 is a lot.
Yes.
So how did you come to know Jenny and first have that introduction?
Well, I already had a long-standing relationship with Jenny, and I felt really comfortable with her as at the time just as my gynecologist. And I had come to her for a consultation, sort of at my wit's end, saying, look, you know, my husband and I have been trying to have children on and off for a couple of years, and I'm just not getting pregnant. And, you know, does this mean that I need to start going down this journey of IVF? And what I was so appreciative of was Jenny was so holistic and genuinely caring about my situation. And instead of just saying, okay, yep, you know, we're at Monash IVF and I do IVF, and so let's get you in, which is what I was, you know, really half expecting. She actually took a step back and asked me about my journey and my health. And I think this is why it is so important that we have female doctors, you know, that we can go to and that we trust, and that women's health is taken really seriously, because I'd never had those questions asked of me before. And, you know, she looked me in the eye, you looked me in the eye and you just said, you know, and she asked me a couple of rudimentary questions and just said, you really should have fallen pregnant by now. So we need to find out what's going on here. And she asked me about my relationship with pain and my relationship with my periods. And I remember going, oh, do we need to talk about that? Like, it's the first time anyone has ever asked me, despite since being 16 years old, going to my GP, complaining about just how much pain I was in when I would have my periods, and thinking that that meant that I was the weakest link. Out of all my friends, I was the weak one who had no pain threshold. And I was the one who needed to take lots and lots of Nurofen to get through.
Yeah. This is unfortunately a very common story. And yeah, I see women, I think, who come in with guilt that they can't deal with the pain.
Yeah.
But they're not meant to have pain like that. That's not normal.
Yeah. It was so much more than that for me. It was shame. Like, I was embarrassed that I couldn't deal with my own period pain, and I needed to manage it with so much medication. And so I would often joke, you know, when I would, you know, go to get anything done, like my eyebrows threaded, oh, look, I have a really, you know, I'm a weak one here, and I'm probably going to end up crying, because it was always just related to me really struggling with period pain. And Jenny was the one who first said to me, the only one actually who ever said to me, that's not normal and you shouldn't be in pain. And I think the thing about pain is it's so personal. You don't know that your pain is greater than someone else's. You just know that, you know, all of our girlfriends, we all get our periods and we all joke about it and struggle through it somehow, right? And there's these jokes about red wine and pizza and chocolate to survive, you know, with a pack of Nurofen to go alongside it. So I didn't know that wasn't normal. And then you asked me questions about my mother and her relationship with childbirth. And with such certainty, she looked me in the eye and said, I think you've got endometriosis. And I went, no. And she said, I think you've got endometriosis. And she opened up her calendar and said, and I can get you in on Monday. It was a Wednesday. We were chatting on a Wednesday.
You remember it in more detail than what I can. I did say, I got out a calendar and I said, you've got an appointment with me on that day.
Yes, she was certain.
Wow.
And luckily my husband was already there, and I just looked at him and I knew that Jenny would never say something that she wasn't absolutely confident in. So we, you know, juggled, got some annual leave in, and I had what was called a
laparoscopy
on the Wednesday, just days after. And And I'll never forget this. I ran into Jenny actually at my local pub years after, and I'll never forget this. I held her hand and told her this story just recently. I woke up in recovery from surgery, and she came over and you held my hand and you said, you did have endo. It was actually quite pronounced, and we've gotten rid of all of the tissue. I don't remember specifically what you said around that, but
I would have said something like, it's all gone.
Yeah.
It's all gone. It definitely would have caused the problem. It definitely would have caused the pain you've had all those years and the problem you've had falling pregnant.
yeah,
And we've put you in the right direction now.
that's what you said. You squeezed my hand and you said, and you're going to get pregnant now. And that was really powerful because that happened in September. And I was pregnant in October. I was pregnant the next month.
The next month.
Yeah.
Wow.
Yeah. And I
That's
have not
amazing.
had any problems falling pregnant since. So then I got pregnant 1 year
She was on a
postpartum
roll.
with my second. And I accidentally got pregnant with my third as well, despite my husband having a vasectomy. So that's a whole other story. So I had no problems getting pregnant once
No,
the endo was
they're
cleared.
not always successful. They're not always successful.
I know that now.
I didn't do the vasectomy or no.
Yes. So I've got 2 boys and a third on the way.
Wow, congratulations.
Yes.
And on the
also-
way. So I knew, but I didn't. I've left it up to you to say something. I knew.
Oh, wow.
Yeah.
That's amazing.
Yeah.
What a
it's,
story.
It really is a story. And not just that, I find my periods now are just a non-event. I can manage it with
I love
Panadol.
hearing
After
that.
years.
I love hearing that. I
Yeah.
love hearing that.
I don't need to manage it. I don't need to think about my work schedule. I don't need to think about, I need to have this many carbs. I need to have Nurofen at this time and at this time, at this time, just to get through day one. There's no mental load. I just
Amazing.
take 2 Panadols if I'm in pain, and that's probably it for the entire cycle. It's so fine. I didn't realise that that's what my life could have been like. So,
Yeah, and it breaks my heart that is such a common story that women are put off, told to take tablets, sent to chronic pain clinics, told to do pelvic floor exercises,
Yes.
and they need a laparoscopy. They need to just have all the endometriosis definitively cleaned out. That is the problem. Yeah.
yeah.
And that's a wonderful outcome.
And you know what? I think the thought of having surgery and the diagnosis, if you've got endometriosis, is daunting. But can I just say, I was diagnosed on a Wednesday. I had day surgery. I think it was day surgery.
No, you
on
would
a
have stayed
Monday.
overnight.
And it was done. And I was better.
Just
Yeah.
like that.
It really did feel like just like that. And there's so much build up, and we get told to do all these various things when it can just be fixed.
Yeah.
That's so amazing. I've got so many friends who have endometriosis.
Yeah.
Like you say, it's common.
Yeah.
And it's to know that it can be fixed just like that that's really, really heartwarming. Certainly, the one that's had multiple surgeries was suffering for years before actually getting someone to listen.
Oh, there's stigma around having pain.
Yeah.
There's stigma around not being able to get pregnant. And looking at all your friends that are doing it, and maybe younger friends and sisters, there's stigma around women's health, actually.
Yeah, absolutely.
This is why
there
we're opening up the conversation.
Yeah.
Yeah.
And there's stigma because it's not talked about enough. As with anything in life, when we bottle things up, there is so much misunderstanding. There's a lot of shame, embarrassment, and a lot of internalized feelings that shade things that shouldn't be the case. We need to be doing what we're doing right now and normalising the discussions about women's health and the challenges that we experience, and the fact that there shouldn't be any stigma around pain and endometriosis diagnosis, because this is our bodies, and this is one of the things that can happen to our bodies, but there's help out there.
Yeah,
absolutely. And we need to take our own health more seriously, just as much as we do anything else.
Yeah, for sure.
Wow. Yeah, I couldn't agree more with all of that.
So a funny story is that I've had the same GP since I was 5 years old, and he's been great. And I remember going to him after I had my endo surgery, and I said to him, I didn't realise that all this pain wasn't normal and that this should have been investigated. And I remember him just sort of putting his hands up in the air and going, well, Shivani, there's, lots of problems that, women can have, and there's lots of various reasons for pain. And it was just such an aha moment for me, again, around the importance of having female health practitioners, female doctors that take this seriously and take us seriously, because it's worth further questioning and investigation. Why wasn't this investigated since I was 16 years old and complaining about it to the extent that it should have been, right? And I just think women get it intrinsically because it's our bodies. We experience this on a day-to-day level, and that's something that just can't be duplicated. And when you find an incredible, female health professional like Jenny, who, number one, just really cares. And Jenny, it's not just you, your team are amazing. I remember wanting to give them hugs every time I walked in because I just felt so cared for. Your life changes because someone genuinely cares and they get it personally.
Yeah. Well, that's absolutely phenomenal.
That's
Can I
really
just share a little story about one of Jenny's scientists that I spoke to once?
Yes.
About the kind of things that they do behind the scenes, because we were out one night having dinner and I was asking about, because I've had IVF, not with Jenny because I didn't know her then.
No.
I had my children via IVF, and I was asking, about the success and how, as a scientist, you increase your success rates. And this scientist of Jenny's said that she goes in and talks to the woman about her family history, particularly her relationship with her mother, her relationship with her grandmother, her mother's relationship with the grandmother. And so she really gets a picture, and also perhaps if they're immigrants, of the genetic epigenetics. So the stories that the females in the family have gone through, and then does certain things with the blastocyst to try and encourage it to fertilise. And she was talking about playing certain music, about reading things.
This scientist, I'm sorry, I'm interrupting, but this scientist that who Renee is referring to is the most amazing scientist I've ever worked with. She's incredible.
Yeah, and
she's caring.
Yeah, and she will find music related to the genetic history of the family and play it in the lab when the fertilisation process is going on, in order to encourage. And I thought, I've never heard of that before. And that is phenomenal. That's Jenny's team.
Do you know
That's
what?
who she works with.
This particular woman is very scientific. She knows all the latest, and I understand this is, a very different practice. But she looks at the different media. She looks at how she can enrich things. She looks at everything. If I talk to her every step of the way about, what we can do differently. And I know this wasn't your pathway. There's many different pathways to reach the goal that you want, I suppose, is the conclusion.
But it's the open-mindedness of Jenny and her team that I think is the huge differential, because the medical profession can be very narrow-minded, as you were describing earlier, perhaps, when you talked about your GP and other professionals, that you've been to, and I know that I've been to, whereas to go to someone who's so open, and her team, to other possibilities, to trying different things, I think that's the big differential here, one of them.
Yeah, I would say that medical science doesn't have all the answers, and you have to be open-minded to try other things. And maybe that's not right for everyone, but being open-minded is important. Listening to the woman is the most important thing. Listening to the woman and listening to her story and letting her know that she's being listened to. Yeah.
And can I just ask you, Jenny, if someone was sitting here at, say, 25 years of age, and they want to meet someone, they haven't met the right person yet, do they freeze their eggs? When should you freeze your eggs, and when is the panic time to find the right person to have that biological family that a lot of women still want these days?
Okay, so women women in their 20s are more fertile than women in their 30s, but women in their 20s, don't we remember, you're thinking about other things. You're being a 20-year-old, you're living life. You generally, life is different when you're in your 20s. You're not thinking about having children. You're thinking about how you can stop having children generally. I generally see women in their 30s to talk about fertility and egg freezing, but actually if women froze their eggs in their 20s, the eggs would be of better quality. That's the reality. That's the scientific answer. But I just don't see many women in that situation. I do have some. There would be some women who have got complicated endometriosis or something called polycystic ovaries, where I can predict they may very well have problems later on, and I do definitely start that conversation earlier. But for anyone, I plant the seed. Have you thought about having children? What would be your time frame? Because you don't want to leave it till your late 30s, early 40s, definitely not. And then you've said, what time do you really start to worry? I think you've got to have your babies while you've got a 3 in front of your age, is what I would say. Do it in your 30s. Not all women are as fertile in their 40s. The numbers really drop after the age of 43. Do it while you've got a 3 in front of your age. And if you can set up your life so that you can do it when you've got a 2 in front of your age, even better. But, you know, you've got to take what I say within the context of the rest of your life. You've got a career, you've got education that you want to have, you've got travelling that you want to do. For most women, it's going to be in their 30s.
And a partner.
And a partner's the other aspect to it as well.
Finding that partner, as many women know, is a big challenge.
Yeah.
That's what I find so empowering, though, about women doing it on their own is, you know, it is often about finding a partner for women, and the reason why they say, I think I'll do this in a couple of years, is because they're hedging their bets. If I find a partner, it'll just be easier and more straightforward and so forth. But it's wonderful to have the opportunity to take your destiny in your own hands, you know, partner or not. I want to have children. And, you know, I know so many women who are single mothers and have found partners thereafter, right? But, you know, the choices that they've made haven't been beholden on, I think you'll be a good dad, or, you know, I've just got to get this done now, sort of thing. And I think that independence, that opportunity is really empowering.
There are more choices for women today than ever before, thanks to people like Jenny, which is just so wonderful.
Yeah.
And it's changed the game.
Yeah.
We are much more in power of our own destiny than ever before as women.
We've just got to choose it, right? And the moment we do, I think the universe, the world opens up for us, our friends open up for us, and we realise, wow, the world actually is as open-minded as we thought it should be.
Yes.
We just needed to place ourselves in that position.
Yes. No, I totally agree.
But what I wanted to say before, and I didn't want to interrupt, was it is so important to listen to a woman's story and to ask the right questions, to do the right investigations, and to think about why are they not getting pregnant. The answer isn't always just sign here for IVF. And in your case, everything was pointing towards endometriosis. And I like to think that you do a laparoscopy, you get rid of the endometriosis, and it's the gift that keeps giving, because it wasn't just for one baby, it was for 2 and now for 3. But it's fixed up the pain as well. It's the gift that keeps giving.
Yeah, it really does. I really do feel like I live an unencumbered life now. Like I haven't had a period in a very long time, thanks to 3 babies, 3 pregnancies, but I don't dread my period. There's no mental load around it. And that's just a very different space to be in. But to your point, Jenny, I've got a girlfriend who has had so many rounds of IVF.
I was going to say this.
Yes.
I'm sorry, I'm cutting across you now. I also see women who have had IVF after IVF after IVF. And in fact, could someone please just press stop and think they've got endometriosis, they need that fixed.
Yeah.
Then they will get pregnant. They may even get pregnant naturally.
Yeah.
Yeah.
And the descriptions that she gives me when, you know, it doesn't, it's not successful, I just keep thinking, that's got to be investigated. Like, why are they just loading you up again?
Yes.
She gave me
Yes.
this example, said it's like there's trees in the way, and so it just can't attach. And so I don't know what that actually means.
No,
but I remember
someone-
thinking, well, do you want to just stop IVF and go to a doctor who cares about your actual health and, you know, have that investigated? And I, in my experience through others, it seems a lot of people don't do that. It's just, you want IVF, here you go. Whereas,
This is what I do.
yes.
Okay, so I would be one of the few who, my background was laparoscopy, and that's how I got interested in endometriosis. And then I came into IVF after that, but I continue to do both. So I can look at the holistic picture and work out what the woman needs. Most will either do most will do IVF. There would be more gynecologists that do IVF, and that's all they do. And there would be some that do laparoscopy, but I would be one of the very few that do both.
Yeah. Thank God you do, because
To assess the thing and think about what I'm doing.
yeah.
Yeah.
Jenny, given the number of women who end up raising their children on their own due to
Yep.
divorce, given the statistics now on the number of women growing who are choosing to have families on their own, can you see a cultural shift in the future where we're a society where women are so empowered they actually have their children first and then look for a partner?
Oh, now you're asking a question. Who knows? Maybe. I think we are meant to be partnered. We are meant to be with someone, but women can be empowered to know that they have got the option of doing it by themselves. I think that might actually be something that stops women from having babies by themselves because they think I'm never going to meet anyone. But only yesterday I said to a woman, this is how, and this was a woman in her 20s who had endometriosis, but she'd seen someone else beforehand and unfortunately an ovary had been removed, and that this has really had a significant impact on her fertility. So we're having conversations at 25, much earlier than what you would normally. But I said to her, you will meet someone. The man that you meet when you've got children is going to be different to the man that you would meet when you don't have children. It may be he's going to be more understanding, more compassionate, more caring, more inclusive. He's going to be different to the man that you would meet in your 20s or early 30s when you don't have children.
Isn't that so true?
Yeah.
And that's what, young women need to be focused on when they look for that partner to have their family with is how are they going to be as a father? How are they going to be when I'm at my most vulnerable, trying to have children, giving birth, juggling everything? That's really the partner that a woman needs, being a mother myself of twins.
Yeah. 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 Yeah.
Yeah, I think your needs change and your expectations change as you're looking for a man as you go down that journey. That first year postpartum is a very involved, beautiful period, but also one that really needs support if you are going to have a man around who's really got to, pull up his sleeves and be in the trenches with you. And then once you get past that year, I think if you're looking for a partner, you're probably looking for different qualities. Maybe he's a lot more fun. It doesn't matter if how he fares at 3 a.m. in the morning because that's not a problem anymore.
Yes.
And the dad bod. No, just joking.
And a mum bod.
And the mum bod too.
Yes, yes.
Let's be fair.
Things change.
Yeah. So I just want to thank everyone for coming here today. Renee, Shivani, it's been great. It's been great to open up the conversation.
Oh, Jenny, I'm just so grateful to have met you and for you taking such wonderful care of me that I just feel like this is, the least that I can do is to come along and have a conversation and spread the word about the great work that you do.
Thank you.
I genuinely hope that you are not the world's best kept secret and that every woman out there who wants to have a baby, who wants to talk about, her health, can find a way to access you just as I've done.
Thank you. Thank you.